I never thought that getting an IUD postpartum after 2 babies was going to be as traumatic as it was, but here we are. If you'd like to know what you might expect at your 6-week postpartum visit, I am here to tell you. If you're new here, hello and welcome. My name is Ginny. I am an elementary school teacher, a doctoral student, and also a mom of 2 lovely girls, Alice, who is almost 18 months, and Mina, who is almost 2 months old. And I am currently 6 weeks postpartum, and I wanted to include a little update, kind of like I did with my pregnancy videos, just all about different things you might expect or what I'm currently going through 6 weeks postpartum with baby number 2. So I will start with the one thing that most people want to know, which is how much weight have I lost in the 6 weeks postpartum. Now I want to preface this by saying I am eating like trash and I'm not really working out. I go on a walk every day with my girls in the stroller, but other than that I really don't do much, and I have lost 37 pounds since my birth. I should probably also mention that I am breastfeeding, so that might contribute to the 37 pounds, but to be perfectly honest, I'm pretty happy with where I am right now. I feel like 37 pounds in 6 weeks is awesome, and I'm feeling pretty good about where I'm at as far as physically. I mean, I carried 2 children and birthed 2 children, so I'm pretty happy with where I'm at right now. I'm not where I was pre-pregnancy, but hopefully I will get there soon. As far as feelings go, now I had a C-section, so these are going to be C-section specific things that I'm going through the 6 weeks. So the first thing that is always going to be a little bit hard to get adjusted to is the fact that your muscle tone in your lower abdomen is pretty much non-existent, and sometimes the skin even feels a little bit almost gelatinous, like it doesn't have any resistance when you push it, because obviously major abdominal surgery, you were cut open, there's just not much definition, so it can feel a little bit strange at times, and you will wind up with a little bit of a pooch. I have a tiny little like bump here just because of the fact that I had a C-section, and like I said, I feel pretty good about where I'm at right now. I know that I'm only going to go down in the numbers, and so I'm really kind of okay with where I'm at physically. Something you may be experiencing that I experience is that my scar area is still a little bit tender, even 6 weeks postpartum. Now it doesn't hurt, it's not excruciating, but it is tender. So sometimes if I toss and turn at night when I'm asleep, then I actually will feel some pain in that C-section area. Something else that some of you may have or have already gotten are stretch marks. So stretch marks can be all sorts of different places. For me personally, I have some on my thighs from my pregnancy, a few. I have some on my breasts, of course. That's a very common place for them. And the last place, of course, is my abdomen area. Specifically below the belly button is where most of my stretch marks are. But stretch marks are something you can definitely expect. Something else that I am certainly frustrated with postpartum is the fact that my wedding rings still do not fit. I have tried putting them on and they are just too small, and they're sausages on my hand. I am hoping, I'm gonna wait a little bit and see if my hands go down in size a little bit more before I resize them, but I'm really hoping that I'll be able to wear them soon because I miss wearing my pretty rings. Something I experienced a lot with my first pregnancy that I have not really encountered much of this time is postpartum hair loss. For me personally, the hair loss that I had in my first pregnancy was kind of like these hairs right around here. So they would kind of like stick out because they would break off, and then the length would be, you know, this long, and they would stick out and look ridiculous. But this time, so far, I haven't had much postpartum hair loss, which I'm super grateful for. Some other positives at 6 weeks postpartum is the fact that I am no longer having any back pain, and I no longer have restless legs. I had real issues with that when I was pregnant, and it was really, really rough. So I'm really glad that that part has moved on. The last thing I wanted to mention as far as symptoms and feelings go is I've had some issues with postpartum anxiety specifically, and luckily I talked to my doctor and I was prescribed Zoloft. I think it's 50 milligrams or something like that, and it has definitely helped a lot. For me personally, when I came out of the hospital, I just felt like this overwhelming sense of guilt about the fact that I had to split my time between 2 girls now, and I knew it was to a point that it wasn't normal anymore, the amount of anxiety I was having over that, because it was irrational. I was literally getting upset and weepy sitting with my first child, playing with her, because I felt like I didn't have enough time with her, even though I was spending that time with her right then. So if you're having any issues with anxiety or you just feel off, definitely talk to your doctor and see what they can do to help you out. I definitely am feeling in a much better place right now. The last thing I wanted to include in my 6-week postpartum update is actually my Iud story, because Obviously, when you go visit your doctor, you're going to have to discuss birth control options if you are not looking to get pregnant anytime soon. And for me, I am at a spot where I am content with my family right now and felt that the IUD was the best choice for me. And I want to tell you the story of how that went. So first things first, I actually wound up choosing Mirena. I was between Mirena and Kyleena, and I wasn't sure which one I wanted to get. However, my doctor told me that Mirena is the more common one, and it lasts a little bit longer than Kyleena, and so I chose to go with Mirena. My only concern with Mirena when I talked to my doctor was the fact that historically I've gotten hormonal migraines when I've had that hormone drop right before your period, and I was worried because Mirena has more hormones than Kyleena does. However, he said because it's localized in the area that it is, it usually shouldn't cause the hormonal migraines that I was used to. So I go to the doctor to get it inserted, and he gave me a prescription to take beforehand, I guess to soften your cervix or something like that. I took the prescription. I also took 2 ibuprofen 2 hours before I went to the appointment. And I like to think I have a pretty high tolerance for pain, but yikes. So basically what they do when they are ready to insert it is obviously they use the speculum to open up access to your cervix, and then they use a swab to clean everything out to make sure everything is clean. And after that, they insert something called a sound and use a tenaculum to hold it steady, and then they insert the IUD. So the problem for me is that apparently I have a tilted uterus. So I'm actually really glad I wound up with 2 C-sections, because evidently it would have been difficult for me to deliver vaginally. But he went to insert the IUD, and it was absolutely excruciating, and the IUD would not go in. We got all the way to the point of the IUD being inserted, and because my uterus is tilted, he was having trouble being able to get it in. So, had my excruciating pain, did not get it in. So I had to actually go get dressed, sit and wait for the ultrasound tech to actually do an ultrasound while he was inserting the IUD, because of the fact that my uterus was tilted and he just needed to be able to see what was going on the inside rather than, like, you know, digging around and making it worse for me. So I get the ultrasound, we go through the same process again, and this time the tenaculum, and I'll put a picture of what a tenaculum is over here. The tenaculum, I guess when it clamped down, it made me bleed profusely, like a lot of blood, a lot. They did manage to get the IUD in this time, so that's a good thing. However, they said, okay, Jenny, I'm gonna need you to stay right here because we need to clean the blood off the floor. And I said, I'm sorry, what? There's blood on the floor? What happened? And my doctor basically said the tenaculum is basically like a snake bite, and so for whatever reason, I just bled a buttload, a whole bunch. Ironically, I did not feel lightheaded afterwards, but the fact that they had to clean up blood off the floor, off of like the bottom of the table, was nothing short of traumatic, and they had to stop the bleeding. I'm pretty sure my OB used like 6 or 7 of those absorbent Q-tips and had to apply pressure to get the bleeding to stop, and then even still had me put a tampon in when I left, and when I got home and took it out, it was soaked with blood. So that was my IUD experience. And even still now, I am spotting, which I know is normal, but I'm so sick of blood. So that's my IUD story. Hopefully yours, if you got an IUD after your postpartum visit, went a lot better than mine. So how are you feeling 6 weeks postpartum? Are you having any issues? Are you feeling good? Are you getting rest? How are things going for you other than baby? How are you doing? I'd really like to know. Please let me know in the comments below how you're doing. If you like this video, give it a thumbs up. Consider subscribing. I'm going to be doing all sorts of different postpartum videos, parenting videos, content like that, and I would love to have you along for the ride. I appreciate you watching, and I will see you next time. Take care.